This is children's Tylenol, but this ain't pharmacology. Welcome to Fluids, Electrolytes, and all about that base. Acid, base, no acid. All about that base. Acid, base. The body is 60% water. Whoa! Yes, it is. And how does all that water stay kind of balanced all around? Well, there's three forces that do it. And these three forces are going to come up repeatedly as we talk about pathologic circumstances. The three forces are hydrostatic pressure, osmotic pressure, and oncotic pressure. Hydrostatic pressure, as the name implies, is the force that fluid creates in blood vessels that wants to seep the water out of the blood vessels. That push to get water out of blood vessels is kept in check by two other forces trying to hold fluid inside blood vessels. One of them is the force of osmosis, and the next one is the force of oncotic pressure created by proteins in the blood. The most frequent, large, and voluminous is albumin. So think of these three forces as kind of a balancing act. If hydrostatic pressure and osmotic and oncotic pressure are perfectly balanced, then fluid stays in the appropriate spaces in our bodies. Here's two more terms. These are not diseases, but they are pathologic states: edema and third space accumulation. Edema occurs when there is an imbalance between hydrostatic pressure and osmotic and oncotic pressure. Matter of fact, a common source of edema is from people whose oncotic pressure falls due to low blood albumin. Blood albumin is a protein in the blood that helps create oncotic pressure. When that pressure isn't there and that protein isn't there to create the oncotic force, hydrostatic forces are unopposed and fluid is allowed to leak out. Another clinical term you may hear is third space fluid accumulation. I used this term for years clinically, and I never really knew what I was talking about. What are we talking about, that third space? Where's the first space? I don't know. So I actually went and did a little research and said, okay, what are these spaces? So I gave you the definition right here. Space number one is the space inside the blood vessels that contain fluid. Space number two is the space inside of our cells that contain fluid. Space number three, or the third space, is that between zone, the interstitial space. Edema represents one manifestation of third spacing fluid. No talk on fluids can really go without talking about loss of fluids, which is dehydration. Dehydration, not a disease by itself, but a consequence of many different things. All dehydration is a diminished amount of water volume in the body. You can lose fluid from various spaces within the body. The most serious, obviously, are the first space and second space, the vascular fluid compartment and the cellular fluid compartment. A lot of clinical presentation that goes along with dehydration. You probably could have guessed them even without me putting a list here. However, the last one is probably a new term to you: orthostatic hypotension. What this term implies is a person with low blood volume, most typically perhaps a dehydrated person, who, upon changing postures from a lying then sitting to standing position, doesn't possess enough blood volume to keep perfusing the brain. Blood pressure falls, and the person feels dizzy or lightheaded. So dehydration does have clinical consequences. Follow me for a minute while we walk through them. When a person is hypovolemic, that stimulates osmoreceptors that we have in our vasculature, and this in turn stimulates thirst. Ooh, would you like a drink? Stimulation of peripheral baroreceptors specifically will activate the sympathetic nervous system and result in vasoconstriction and an increased heart rate. Now, when you reduce volume to the kidney's endocrine function in terms of secretion of renin will be kicked in. That'll activate the renin-angiotensin-aldosterone system. That will retain water and increase blood pressure. Also, osmoreceptor stimulation will result in the pituitary gland secreting antidiuretic hormone, which along with aldosterone will help increase water resorption in the nephron. Now let's do a little stint on electrolyte imbalances. This is a lot of terminology, and I want to let you know that all of these electrolyte imbalances will pop back up as we start talking about individual diseases. There's no need to memorize the numbers for purposes of this class. I present them to you so you can start familiarizing yourself with them. The most important clinical manifestations for these electrolyte imbalances I have highlighted in red. Sodium and potassium, the two major electrolytes that are positively charged in our bodies. Sodium's place is primarily in the vasculature. Potassium's place is primarily intracellular. You don't have to memorize these numbers, but look at the difference in the numbers. These numbers come from drawing a patient's blood. Can you see how much more sodium there is than potassium? Now, when sodium effects go high or low, one of the most common clinical things you will see people do is worry about the potential for seizures. The reason why is that as sodium levels fluctuate up or down, water inside and outside the cell fluctuates up and down. For neurons specifically, this fluctuation of intraneuronal cell volume can cause neuronal irritability that manifests as seizures. Potassium. Throughout your clinical life, potassium that is high or low, the first thing people are going to worry about is what's going on with the heart. They're going to slap some EKG pads on there and they're going to get a reading for the heart's electrical activity. Remember from A and P, calcium, sodium, potassium are all three necessary electrolytes for cardiac depolarization and repolarization. Since potassium is in a relatively narrow range, relatively small increases up or down can affect myocardial repolarization and depolarization. Matter of fact, just for those of you who are interested, back in the 90s, there was a very infamous pathologist that used infusions of potassium chloride in something he called a suicide machine to help his patients commit suicide.